Hello, good evening, and how are you? Welcome. Good evening, good morning, good afternoon, wherever you are joining me from. Welcome again to another live session. Here I'm live on Facebook and YouTube. If you can hear me and you're watching this video after we have ended, and sorry, I might not be responding to your comments, but if you can hear me and you are live with me right now, just say hello. Say hello. Okay. One favor I think I need from you tonight is that I want you to help me share the live stream. Share this live stream. Everybody, share the live, share the live stream. Okay, I see you, Divine, Fina, Divine. I see you. Good evening, everybody. Good evening. Good evening. I see you. Good evening. Okay, I want to do something. Yeah, I'm sending someone. Okay, tonight is very important for those on my Facebook group. For those on my Facebook group, I'm sending two people. I'm bringing two people up to be live with me tonight. Yeah, let's see. Okay, let's see. Three people. Okay, I'll bring the three of them. I'll bring the three of them. Let's do this. Let me do this. Okay. Yep. Good evening, everybody. Good evening. So I want to bring up some people. And Greater Walter, do you remember me? No. Is live or not? Is live on? I'm live right now. I'm live. So I'm going to bring up some people who are on my Facebook group. Hmm? Yeah, I'm going to bring them on the live stream tonight to ask me questions. Vivian, good evening. Good evening, everybody. Let's see. Come on, ladies and gentlemen. This person asking me to make video. Please, madam. Yeah, it's not easy. Good evening. Yeah, I see you. Good evening. Good evening. Oh yeah, share the live. Share the live. 37 people. Your question, Sharon. I see your question. Oh, your question is very interesting. I don't know if I should pin this comment on the screen. Do you want me to pin your comment on the screen? Somebody says, "Oh yeah, ladies and gentlemen, share the live stream. Oh, yeah, let's share quickly. Share. Let's share the live stream. 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 Good evening. I see you. Good evening, Busayo. Annie, good evening. I have shared. Okay, thank you for sharing. Some people on my Facebook group, I have a private Facebook group. I do, right? And one benefit of being in my on my Facebook group is that you can select topics for me to make a video on. Of being in my on my Facebook. So tonight, I'm going to bring up two people from my Facebook group. Please, question on miscarriage. I ask your question quickly. Ask your question. Well, ask your question. Good evening, my madam. My network is messing me up. Okay, share, keep sharing the live stream. Ladies and gentlemen, share the live stream. And then don't forget to send stars. We have 33 people listening to me right now on one of my Facebook page, and then the other one. Is it possible? Okay, sir, please. Okay, Sharon says I should pin her comment. Okay, no problem. Sharon, I've seen your. Sir, please talk about how menstruation causes anemia. You know, when some women are menstruating, they lose blood. In severe cases, these women can bleed heavily. So when they lose blood heavily, um, they develop anemia. So anemia simply means that the woman has low blood. So when a woman is menstruating, normally this woman is not supposed to lose a huge amount of blood. Hmm? Please, do you understand, Rachel? Yeah, ladies and gentlemen, don't forget you can send stars. You can support this page by sending stars. Are we together? Sharon, please send your question again. So the lady that asked me about menstruation, for some ladies, they can bleed heavily and lose blood. And when they lose such amount of blood, which is so heavy, they can actually develop anemia. Good evening, good evening, good evening. Doctor, let me go to YouTube. Patient is joining me from YouTube. So let me also support those on YouTube. Please, doctor, is it possible for someone not to see her period for 6 months? It's possible. It's possible. Ladies and gentlemen, please share this live stream. Share the live stream, guys. Support me by sharing the live stream. Support me by sharing this live stream. Support me by sharing the live stream. You can't just be here and not support. Support. Okay. Yes, patience, I've answered you. Is it possible for a gum to grow back? What do you mean by gum growing back? When you say gum growing back, what do you really mean growing back? As long as the gum is fine, there's no problem with the gum. Your gum shouldn't be growing back per se. My network, my network is acting up. Okay, please, doctor. Let's see. This comment says, please, doctor, talk about blood pressure solutions. Amusa Ismaila, high blood pressure solutions. Is that what you're talking about? The solution for high blood pressure, number one, there are many factors involved with blood pressure. Hmm? Lifestyle is very important. Some people want to control their blood pressure, high blood pressure, without taking medications. If your blood pressure is extremely high, you would have to be on medication. Is that okay? I'm seeing your comments, ladies and gentlemen. Please, I'm taking it one after the other. I'm taking your comments one after the other. Don't forget, please share the live stream. People are not sharing. Make una share. I'm going to put my account number on the screen, though, so that I'll use to buy data again. Yeah, support. Share the live. Thank you. So, Ismaila, to control blood pressure, we have what we call non-pharmacological exercise, um, reduce your weight, reduce your salt intake, cut down on fatty foods, stop alcohol, stop smoking. These stuff would help you. However, if you have done all this and your blood pressure is still high, you might be on medication. Is that okay? I have a question. Let's see. Does candida have resistance on drug? Yes, you can develop resistance. Candida can develop resistance. Any microorganism can develop resistance. Dear, good evening. Veronica says, how do I do what? Vero says, how do I do that? How do you do what, Vero? How do I do what? Okay. Yes, sir. So what can be done if a woman does not see her period for 6 months? She has to speak with her doctor privately. Ladies and gentlemen, share the live. Keep sharing. Keep sharing. She has to speak with her doctor privately. What can be done? What can be done? We don't know what is making you not see your period for 6 months. We can't do that on social media. You have to go to the hospital and speak with your doctor. Is that okay? That is the way out. What is the major cause of miscarriage? I just had one on Saturday. Agatha, sorry. Sometimes you might not even know the cause of the miscarriage. It could be from the fetus, it could be from the mother, it could be unknown, it could be chromosomal abnormality, it could be um, a medical disorder with the mother, the woman, it could be uterine problem. But most times, the major cause might be from the fetus, chromosomal abnormalities. And sometimes you might not even know what is causing that. Um, Please talk about high prolactin that refuse to balance even with the drugs. Tilapa, love Jessica. Okay, if you are just coming to my live stream, and this is your first time, you are welcome. So on this page, I don't prescribe medications. I only advise. Do you understand? Yeah. For those that are just coming for the very first time, so I said, let me inform you. So if you have high prolactin, sometimes high prolactin can be very stubborn, can be very hard to manage. Are you seeing a medical doctor? I believe the doctor would explain to you. Sometimes you might take all the medications and yet the prolactin is still high. So I don't know why it's still remaining high. Have you seen a medical doctor? Have you seen a specialist, an endocrinologist? Good evening, ladies and gentlemen. People are not sharing this live stream. Good evening. Can implants cause vomiting in a woman who had the symptoms, got it removed, but vomiting persists? If you have your implant removed and you're still vomiting, the cause of the vomiting might not be from the implant. People are not sharing the live stream. What can I do now this evening? Okay, so just Jenny, if they remove the implants and she's still vomiting, most likely the cause of the vomiting is not from the implants. I think I will move over to YouTube directly and just stay on YouTube for a while. Hmm? Now for this Facebook, just you understand. Good evening. What is the cause? See, I have so many comments here, so I'm taking them one after the other. What is the cause when you are to see your period on 11th and it comes on the first? 11th of the month and it comes on the 1st. Kazim Busayo, do you know the length of your menstrual cycle? Because sometimes your period would not come on the exact date. It can change dates, but if you're supposed to see it on the 11th and it comes on the 1st, is that how it happens every time? Every time? Some ladies believe that since they saw their period on the 2nd of January, they must always see their period on the 2nd of February, 2nd of March. No, your period can change dates 2, 3 days. But if this one more than 1 week, hmm, it could be stress, it could be maybe you lost weight, it could be maybe you took medication, it could be maybe you had hormonal issues. I easily I easily come when making love to my man. Sometimes I come while he reminds, please, what should I do to last long? Madam, this is not a woman can come multiple times. Sharon, a woman can come multiple times. You are not the one to be lasting long. It's actually the man. So if you come the first time, you can still continue. You come again. You understand? But for the man, it's actually the man lasting long. If you come, nobody says that because you cannot continue in the activity. Is that okay, Sharon? Hmm? So many women are like this. It might be your body, it might be you are very deeply affectionate of your partner, but because you come does not mean that then there's a problem. Many women can come multiple times during the act, but if it's a man that comes very early, it can cause a problem because he might not be able to continue that act. But as a woman, if you come, you can continue. Women they come. So some ladies have never even come in their entire life. Some women never come in their entire life, and yet they are still okay. Why for some other ladies they come? So it'll be like, auntie, you they come? How you they do am? Me never come before. So you don't. I don't feel you have a problem. I just think that you can continue in the act. Is that okay? Ladies and gentlemen, if you can hear me, if you can hear me on YouTube, if you can hear me on Facebook, share the live now. Wow. If you are not seeing your period, it's either you have PCOS, is not normal. So you know if she has PCOS, Destiny. Is that how they make diagnosis of PCOS? Hmm? Destiny. Is that how they make diagnosis of PCOS? Ha, madam, calm down, oh. No, they give people diagnosis like that. Oh, this is the reason why we don't mention diagnosis on social media. How do you know she has PCOS? How do you know? How do you know? What do you know about her life? You don't know anything about her story. She's just saying that she's not in her period. What if she's pregnant? What if she's pregnant? What if she has hormonal imbalance? What if she has severe weight loss that is making her not see her period? So you don't just wake up and tell somebody you have this problem on social media when you don't even know anything about the person's health. And even doctors too don't say that online. How much more? So I beg. Um Agbesi, good evening. I see you on YouTube. Good evening. For those on YouTube, how are you? Sir, please talk about abnormal pain in the down part of a female tummy and at the same time can't pull. When trying to pull, you feel pains in your anus. So many women can have lower abdominal pain. There are many things that can cause lower abdominal pain in a woman. So many things. So many. It can be from the uterus, it can be from the bladder, it can be from the pouch of Douglas, it can be from even the uterus. It can be a mass, it can be infection, it can be her lifestyle, it can be her diet. So many things can make a woman have lower abdominal pain. So if you want me to talk about lower abdominal pain in a woman, that's a different ball game entirely. It can be from the ovaries. So there are many causes of lower abdominal pain in a woman. Then if you say you can't go to toilet, I beg, when I share this live stream, I just they waste my time online. Huh? Ladies and gentlemen, are you guys sharing this live stream at all? Or I just they waste time? Please now share. Um okay. Yeah, send me stars, send me stars. Not the kind of star that Fat Matter is sending me, oh, not that type of star. So Becky, there are many causes of low abdominal pain in a woman, oh. So many. I can't tell you what you are having. It's from your ovaries, it's from your bladder, it's from your uterus, it's from the kidney. The kidney is a little bit high up. Um, hmm, so many causes. It could be from even the tubes. So how will I know what is causing your pain? There are so many causes. It might be from your diet, and then you can't poo at the same time. Maybe your diet. So I would advise you take more water, take fruits, to see if it will help you. But if you've done that and it's still not resolving, please, 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 please go see a medical doctor. Agatha, I have answered you. Oh my God, see me gonna see questions. So many questions here. Oh, Doreen Onua, good evening. Okay. And immediately I come, I get tired and I no longer have the urge to make love to my man until he comes. Okay. Sharon, you just have to. Personally, I don't think you have a problem, but though you can work on yourself, or you need to see a sex therapist. My network is bad, though. My network is bad. My dear, what's your name? Your name is Patience. Patience, you will have to go to the hospital, madam. You will have to go to the hospital. This, not that star, my dear. Fat matter. I'm seeing your comment with my other device. Not that star. Not that one. Patients, you will have to go and speak with a medical doctor at the hospital. You cannot sit behind your phone and try to look for the cause of your problem online. There is no way. That is not how we work. You would have to speak with a medical doctor privately to help you. Hmm? Yeah. Tessie, good evening. What are the causes of heartburn at the end of pregnancy? At the end, you are still pregnant. When a woman is pregnant, her baby increases in size. When the baby increases in size, the baby can push the stomach up. When the baby push the stomach up, anything the woman eats can give her heartburn. It's because the baby has increased in size. The uterus is very large, so the uterus will push her stomach up. The belly will push her up. So anything she eats gives her heartburn. That is it. So sometimes the doctor will advise you. I hope you have a doctor, not the one you are managing yourself at home. Mm. Um, Doctor will now tell you, oh, reduce the amount of food you are eating. Don't eat too much at a go. Take the food little by little. What is the solution for tooth hole? You see a dentist, Jumbo. See a dentist, eh? That is the solution. See a dentist. Sharon, I think you should see a sex therapist. Hmm? I think you should see a sex therapist. Lucy, how are you? Doctor, what can cause low sperm count and motility? Low sperm counts in a man. Maybe the man has maybe. Listen carefully. I'm not saying this is the problem. There are many causes. Maybe the man has hormonal issues. Maybe the man has autoimmune issues. Maybe the man has issues with the testicles. Hmm? Or the lifestyle might be the cause of his problem. It might be lifestyle. You understand? Good. Or maybe he has some other medical disorders that are affecting his sperm count. So uh, Vivian, Vivian, are you here? Ladies and gentlemen, we can share this live stream. Oh, share. What kind of infection can what kind of infection um, cause men to urinate blood? So this is the problem. Your mind believe that it's an infection. What if it's not an infection? Hmm? Vivian, what makes you feel the cause of the problem is an infection? What if it's something else? So your job should not be trying to say if it's an infection. Your job should be the man should go and see a medical doctor. Let them find out why. Um, Blood in urine, is it total blood? Is it at the beginning of urination or at the end or throughout? There are many causes. They will check his bladder to find out if indeed he has an infection or he has a mass. Hmm? I'm trying not to mention any other word because if I mention that word, now people now say, God forbid, it's not my portion. So, a man urinating blood, please, I beg you, your job should not be asking if it's an infection. Your job should be how do we get to the diagnosis on time? What is even the age of the man? You don't even, we don't know anything about this man. There are many causes of blood in urine. Infection can cause that. Trauma, a man if he get injury, if he fall. Hmm? Malignancy, cancer can cause that. Blood disorders. So I would advise you that the man should go to the hospital, and stop trying to look for the infection. For the infection. What gives the cause for teenager to see her menses for 1 week, and the first 3 days it comes heavy? For 1 week. So for teenagers, their body is still changing. The body is still changing, hormonal changes occurring. So sometimes the period might disappear, sometimes the period might come very heavy. You understand? But if you notice that this bleeding is very heavy, she's having severe pains, let her see a doctor. But in some teenagers, they can see their period for few days, it will disappear. 1 month, 2 months, 3 months, later it will come back. Doesn't mean that she has a problem. It's her body. Her body is still trying to adjust, hmm, to being a woman. Onome, good evening. How are you? I see my period on the 12th of January, but this month I see it on the 3rd. Doctor, please, I don't understand. Beauty, what is the length of your menstrual cycle? What is the length of your menstrual cycle? Do you even know the length of your menstrual cycle? If you know the length of your menstrual cycle, then we would understand. We will understand. Okay, the length of your menstrual cycle is 21 days menstrual cycle, or your length of your menstrual cycle is 24, or 26, or 30 days, or 35. Then we'll understand what is happening. So, do you even know the length of your menstrual cycle? Very important. If you know the length of your menstrual cycle, you'll be able, or will be able to know if there's a problem somewhere. Hmm? 12, 13, 14, 15, 16, 17, 18, 19, 20. Eh? So please go to my YouTube channel, Beauty. Go and watch the video on how to calculate the length of your menstrual cycle. Beauty, go to my YouTube. You will see a video on my YouTube. Watch the video. Good evening, Doctor. Can asciasis problem stop a pregnancy? Asciasis problem stop a pregnancy. Asciasis problem. What do you mean by asciasis problem, my guy? I beg, I don't understand. Asciasis, asciasis problem, asciasis problem. Asciasis is no pregnancy. So what do you mean by asciasis problem? Asciasis means there is no pregnancy. So what do you mean by asciasis problem? Who told you about this one? Watching from Gambia. Make una share the live stream, ladies and gentlemen. Nobody don't even send me star this night. Oh yeah, share. From Gambia, Ghana. Bright. Hey, how far now? Not this star, not this star. What is the root cause of ovarian cysts? Hey, God of heaven, tell me that. Swear, say you never check Google, read about ovarian cysts. Daniel, swear, say you never read about ovarian cysts. And guy, mm, there are many types of ovarian cysts now. Ovarian cyst is common in the reproductive age group of a woman. When a woman is in a reproductive age group, a reproductive age, eh, the woman, the woman, the woman, if he gets ovarian cysts, these people are not even sharing this live stream at all. Okay, doctor, I do have headache. Having headache. See, see this comment. What's the cause of frequent headache? And this other person says, I do have headache. It's abnormal to be having headache. So every time, having frequent headaches is not something to joke with or something to play with. Do you understand? There are many causes again of frequent headache. You are not sleeping well. You are stressed. You have maybe you have high blood pressure, maybe, or you have space occupying lesion. Hmm? Every time, always having headache is not a good sign. You should you should um you should get yourself examined to know why. Dear and Geraldine, frequent headaches. Do you have increased intracranial pressure? Though raised intracranial pressure will not even allow you to be coming online and be typing this one you are typing. Okay. Um, let's see this question. I will end this live stream very soon. My God. Good evening. Can a man with undescended testicles be fertile? Helen Bayem. Is it one testicles or the two testicles? One of the two. Is it one or the two? Good evening, doctor. Please, is it normal to see blood in the diaper of a baby girl of 2 months old? It's not normal, madam. It's not normal. Just right, it is not normal. Doctor, during ovulation, I have some signs of ovulation, but I didn't see the egg white sign. Does that mean the egg is not released? No, madam. You have not even watched my video on ovulation, because if you watch that video, then you would understand it. Your answer is in the video. Hmm? Because you did not see egg white, that does not mean that you did not ovulate now. You have other signs of ovulation. Hmm? Not every woman would have the egg white. Is that okay? Okay. Destiny, good evening. Chika, Kalu, good evening. Okay, I have taken all the questions here tonight. Thank God. I have been able to take all the questions today. Omo. Chika, Kalu, good evening. Okay, I have taken all the questions here tonight. I have been able to take all the- Sir, I just want to say, sir, please reply me. Sir, reply me. What is your question? I can't see your question. I can't see your question. Your name is Divine. I can't see your question, Divine. The two. Okay, the two. If it's the two testicles, my advice would be that you see a urologist. Hmm? You see a urologist so that they can assess the testes. Do you understand? See a urologist so that they can help you assess the testes. And he said, "Thank God, Susan." So Susan, you dey here. They look me since. I can't see your question, Divine. You are pinning your question. This is my question. See, it's not showing on my screen here. I'm not using the normal Facebook. Do you understand? Here. The two. So see, you have to see a urologist. Let them assess the two testicles. So I can't give you a yes and no answer. Helen, is that okay? I have responded to your question, Fat Matter. I have responded now. You asked about um a teenager same period. I respond now. Okay. And he said, "Thank God." Yes, so my dear, these questions are cracking the brain. This is my question. I can't see your question. Divine, I'm serious here. Please, sir, respond to my question. I've responded to you now. Fat Matter, Sise. I responded to you. See your question here now. I gave you an answer. The question is concerning one teenager same period. Um, what is the cause of teenager same period? I responded to this now. Hey God. Which I know saying na cracking of brain that they do for years since morning. I said it might be normal with her. It might be normal with her. She's a teenager. Her body is still changing. But if you notice that there's severe pain, there's severe pain. She's seen her period. The bleeding is very intense. She's becoming dizzy. Let a doctor check her out. Is that okay? Let a doctor examine her. Yeah. See, oh, look at this comment, guys. Good evening. Please, my head is itching me and also paining me, I guess. And some of my hair is falling out. Okay, blessed Kingsley. What do you want me to do here? You want me to tell you medicine to buy? No. You look like a lady, Abby. You look like a lady, Abby. You sound like I don't know if you are. But even if you are not a lady, you are a man or you are a woman and your hair is itching you. Eh? Come guys, if I read your question pass, I answer am, I no go fit repeat am again. You understand? Abeg. My hair is itching me. So I can't tell you what is causing your itching now. I always say is that this platform is to advise you, is not to treat you or prescribe medication for you. So I don't even know why the hair is itching you. I don't know, and your hair is falling out. You have to see a doctor. Let them examine that head for you. Eh? Let them examine the head for you. Do you have an infection or do you have SLE or whatever? Do you get? So let them check you. Blessed. I know you might have taken so many things and it's not disappearing. So you want to find out what can cause that problem online. There's no way we can find that out on social media. Hmm? There's no way we can find that out. If it be, see, if it be Susan, if it be lies, if it be something else, you get. Nobody don't say me start this night. Ah, God, I beg, oh, God. Okay, if it be lice, if it be normal fungal infection, if it be SLE, and I'm using that word deliberately, and if it be autoimmune condition, so they have to find out why within the cause am and check the head out. Huh? Let's see. Yes, so at the look, oh, is there any natural way to reduce bloating in the stomach? Please don't make that face again. Susan, I will keep making the face now, to my dear. As the funny talk, so I don't tire, but I have to do this. So bloating, bloatedness. Why are you bloated? Are you always feeling bloated? It's not okay to be feeling bloated. Maybe you get indigestion, or your stomach they produce too much gas. If you're always feeling bloated, find out what they cause the bloatedness. Now, milk, sometimes you can feel bloated with milk. Sometimes people can have peptic ulcer disease and they will get bloated abdomen. So to help you, maybe you will go on fruits for a while. Try take fruits to see if it will help you. Eh? But if you know, say this bloated abdomen, they always disturb you. They frequent, recurrent. We need to find out why. But generally, leave heavy food, take water, take fruit, and see if it will help you. Um, let's see. Please, how do I get rid of pain on my throat region and a little lump? How? By going to the hospital, my brother. You can't get rid of throat pain in your throat and lump on social media now, guy. Hmm? You can't get rid of that on social media. We are not like that. We are not those kind of people who will come online and be sharing medication for people. It's not done that way. We have a license and we'll protect the license jealously. And the license does not permit us to just come online and be sharing medicine for people anyhow. So if you know you have pain in your throat and you have a little lump means swelling, abi? uh How do I know where the lump is? How do I know the lump is not something to be bothered about? How do I know if you don't have any swelling in any other part of your body? So these are very important stuff that I always say this. I always say this. This platform is not a clinic, does not take the place of a consultation, and we are not here to take the place of your doctor. So please, my brother, you would need to see a doctor. Very important. Make them check your throat. Make them look am. Find out the lump where they there. Wetin dey cause am. Somebody say, I no understand how this sending of stars they work. Just look at your comments. Beside your comments on your Facebook app, if you are using the normal Facebook, you will see a star, golden color star. After the golden color, you will see that like sign. Thank you. Yeah, Fatima, thank you. What is the best way to do what? What is the best way? How many of you are on my Facebook group? I have a Facebook group. Oh, I have a Facebook group, and on that Facebook group, you can you can vote for a video. So you can vote for a topic, and if you vote for the topic, I would make a video on that topic. And if you're in my Facebook group, hello, yeah, how far? Yes, my okay, okay, no problem. Okay, guys, give me 2 minutes. 2 minutes. Ah, God. Okay. Yeah, well, yeah, good night. Okay. Okay. Oh, yes, ovarian cyst. What's the best way to get rid of? Joseph has sent me 100 stars. Joseph, what do you do? Mr. Joseph, what do you do? Please, what's the best way to get rid of ovarian cyst when it's still in the early stage so as to avoid being operated upon? Ah, the best way to avoid it being operated upon, say, because sometimes the ovarian cyst can just develop problems on its own. Sometimes the ovarian cyst can get infected, you can just get problem. So you might try to do everything yet to still get problem. Sometimes you will just be fine, it won't give you any issue. So I can't really say this is what you will do. I don't even know the type of cyst you have. And sometimes women have ovarian cysts and they are good to go. Sometimes the ovarian cysts can now begin to increase in size and cause them problem. So there is nothing really spectacular I can tell you to do and mm, to what again? Okay. I don't dey tire. Let me appreciate this guy that sent me stars. Joseph sent me. Hey, Dr. Jason, how far now? Dr. Jason, how are you? Dr. Jason is in the house. Dr. Jason is watching from my other Facebook page, I guess. Dr. Jason, how far? How are you? How your body? I want to ask, are people afraid of going to see a doctor? My brother, very good question, though. Very good question. Ladies and gentlemen, are you really afraid of going to see a doctor? We have Dr. Jason in the house, is in Abuja. Joseph, thank you for the 100 stars you sent. I have seen the stars. Joseph Omarebu Lenlo. Yeah, thank you so much. Thank you for the 100 stars. Oh, yeah, send stars, people. Okay, so let's read this comment quickly. I sent someone for urine microscopy culture and sensitivity, and when the result came out, it was mixed growth of Staphylococcus and Candida. After treatment, 4 months later, she went again, and this time it was heavy Candida. Meanwhile, her period stopped for 2 months and came back this January. Meanwhile, all her time of making out with a man, she has never been pregnant. So, Divine, um, this your question. It has a lot in it. There's a lot in this your question. Huh? Make una share this live stream. There's a lot in your question. First of all, there's a problem with urine with microorganisms, and then there's a problem with trying to conceive. The two of them can be totally different, or maybe somehow they are linked somehow. So I think this woman would need more details to really find out about her. She would need more review. The doctor will examine her, find out why is she not getting pregnant. She might be fine, it might even be from her partner because she has this complaint, or she even have problem with her period too. She might still be ovulating, or she might have hormonal issues, or she might have ovarian issues, coupled with the fact that she has candida in quotes. So there is a lot in this complaint here. There's a lot that needs to be traveled. Rita, Jason, I see your comment. Shebi, my brother, you see Amabi? There's a lot here. So the best for this lady, leave. See, I think you are trying to tie her problem to that infection. Please, you've done the best you can. You have treated her. She's still having the problem. She's not seeing her period. Period is irregular, most likely, and she's not getting pregnant. We don't know anything about this woman. We don't know her age. We don't know what she does. We don't even know she's with her partner. They are having regular intercourse. So there's a lot to find out from this patient. And I think that it's not just about the urine. There is more. to eat. Ah, yes. Jason, Dr. Jason, how far? Dr. Jason say, I will send you the link to this live stream, right? Dr. Jason, I will send you, ma, just even hear your voice. Mama, know how you did. Let me see. Ah, this laptop they give me problem. Oh God. Don't tire. Uh who sent me message now? My screen is hooked. Okay. See, don't hook up. Okay, there are no more comments for me. Okay. Thank God you don't come out. Okay. Yes, so I don't answer the questions where I feel answer. Thank you. Doctor, you haven't read my comments. Amarachi, I can't see your comments. Your comment is not coming up. Who go send me star again? Somebody should send me star, or somebody should send me iPhone 18. Yeah. Amarachi, I'm not seeing your comments. Oh. Ah, my network is messing up. Okay. Yes, so I don't answer the question. Okay. No more comments. I'm not seeing your comments, Amarachi. Sorry, yeah? Mr. Joseph, thank you for the stars. God will bless you. Who else again? They look me. They look me. If not knocking now, here go full. If not knocking, here go full. But no problem. Please take note that we don't prescribe medications here, and this place is not a clinic. We're just here to advise you. I beg. Amarachi, I can't see your comments. Dr. Jason, Dr. Jason, are you still here? Private chat me on this live stream. Dr. Jason, private chat me on the live stream. Let's see if you can send me a private chat on this live stream. If you can. Susan says, I don't understand how this sending of stars they work. Uh, oh yeah, now Amarachi, I'm waiting for you. Any more comment? No more comment, Abi. I'll go end this live stream now. Go TikTok, self. Abi, make I stream TikTok live simultaneously. Oh, I don't get power. I don't get power to do this. To do two live streams for your stream at the same time. So let me go live on TikTok. Where you ask me questions. Okay, oh, you see, when a company does rubbish, are we good? Dr. Jason, are you here? I'm not seeing comments again. Hope I've not been locked out by Facebook. Hello, doctor. Long time on your live. Nice to see you again. Ngozi says, nice to see you again. Long time. Ngozi, I've been here. Oh. Now you disappear. I've always been here. Yeah, I'm live. Okay, we are live on TikTok. Okay, doctor, Destiny, doctor, can impotence be cured? I will say yes. I will say yes because of the current knowledge we have in medicine. You can actually manage impotence in quotes. You get, yeah. You can manage it. You understand? Ah, my stand is not here. Oh, Wala be like waiting again. Wala be like this thing. Okay. So you can we have to find out what is causing the problem, and then they manage him. So you can manage impotence. I would advise that any man having this condition should see a urologist. They would help him also by the grace of God. Good evening. Having issues. Okay, let's see these comments on Facebook. Comment says, "Good evening, doctor. Please, I'm having issues of big tummy when I'm not get married. Amarachi says, "Good evening, doctor. Please, I'm having issues of big tummy, and you are not married. You are not married, and you have problems with your tummy. Your tummy is BK. Please, what should I do? I always pray for flat tummy." Amarachi, um, you can't pray for flat tummy. Oh, you can't pray for flat tummy. Don't let anybody deceive you that you will pray for flat tummy and you will have flat tummy. There is one video of one man of God that was praying, fat out, all those ones now, obubu yeye. Hmm? Just to disgrace ourselves in the for the international community to see. If you want to have flat tummy, madam, it go cost you hard work, or you wan go for liposuction. There's what we call liposuction. They go help you comot the fats, you understand. But if you want to burn down abdominal fats, you go need to exercise, or exercise very seriously. You go reduce the amount of calories wey you dey chop. If you dey chop 4 people food, you go reduce am. Then you go exercise. Calorie na food wey dey give you energy wey go body come convert to fat. Excess calorie, if you chop 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 chop, you no burn am out, your body convert it to fat. So when you eat that food, you have to burn it out. And then the time you eat is very important too. If you dey eat for middle of the night, like who dey pursue anytime, you go just wake up for night, go see say na rat dey waka, but na human being na im dey go find food chop. You go need to reduce am, you go stop am. Then try go on fruits. So in a place of taking food, try take fruits. Maybe e go help you. Good evening, those on TikTok. Una good evening, how una dey? So you go try take fruits and exercise. Losing fat na hard work. Tummy trainers no go help you. Tummy trainers no go help you. Is that okay? All those tummy trainers na lie. Amarachi Joyce, I'm sorry, I'm not seeing your comments. Destiny, thank you. Amarachi, I'm not seeing your question. No. Chiamaka, how are you? Slim Nikki, how you dey? Slim Nikki, how are you? Somebody says, Doctor, I want to share something with you privately. Please, it's very important. Is it concerning medical stuff? Because I don't do private chats on social media. I don't do I want to chat with you privately. I know they do am. No vex. I know they do am. I'm very, very clear on it. The moment I start allowing people sending me private messages, um, it brings room for disregard. So I love my private space a lot. Um, I tell people, and I'm going to say it with my full chest, if I'm going to have a private session with anybody on social media privately, I speak with you privately, you would pay for my private time. You understand? My private time is very important to me. So I beg, no vex. I don't do this. I want to chat with you privately and the rest. Everybody want to chat privately. I can't do that. I'm very sorry. But if you want to have a private chat with me, there is a link on my page. Click on the link. You will book for a consultation. You will pay for the consultation. I beg. I know they do all this. I want to chat with you. See this one. See. Um, what are okay? Okay, you have the Flow app. Okay. I just did an ultrasound scan. How can I talk to you so I can show you for you to explain, sir? I'm sorry, madam. I don't do that. Yeah, I'm sorry. I don't do that on social media where you do scan, you can't show me. I don't do that type. I beg no vex. I know fit. The one where I fit do now I don't do for you. So and that's what I'm doing here. Hmm? I beg. Please take the result to your doctor and show your doctor. Hmm? No vex. I can't bite more than I can chew. I ask, okay, I'm 6 weeks gone. Oh, congratulations. You are 6 weeks pregnant. Congratulations, Slim Nikki. Yeah, congrats. Don't worry, you go born. Now twins you go born safe. I ask the cause of dizziness always at night. Dizziness at night. Dizziness at night. I don't know. God, dizziness at night. Um, you think they call dizziness at night now, madam? See, me no, no. Make I no go tell you rubbish. Oh. What do they call dizziness at night? If you're having dizziness generally, we can say generally, maybe you are stressed, maybe you are not sleeping, maybe you're not eating well, maybe you have anemia, maybe you have nutritional deficiency, maybe you get. But at night, what can cause that for you at night? Maybe there are other symptoms that you are having that might help us. Um, I'm a twins. I don't want to have twins. They are wala too much. You will born twins. You will born twins, boys. One will be called Frederick. The other one will be called Frank. Receive it. You will born twins, twins boys. Okay, so Amarachi Joyce. I can't say. So maybe it's the job you did during the day. The job you did during the day. Maybe that is why you are feeling dizzy at night. You are stressed. You are not eating well. Maybe, eh? Maybe you have nutritional deficiency. You get maybe. So I can't say why you're having that. Yeah. So people are telling you congratulations on Facebook, on YouTube. Congratulations. When is the best time for me to register antenatal? Let me not lie to you. Let me not lie to you. We tell women that even before you get pregnant, your doctor should be aware that doctor, I dey try get belle. They will now tell you, okay, start your folic acid, what we call preconceptional care. The moment you miss your period, come back to the hospital. Let's see you. So if you have a doctor, you have your doctor. I will advise you that you go back. Um, Make it see you generally, make it check you if there's any problem. If there's no problem, they will tell you to go home. But if you don't have a doctor at all, nothing, I will say, okay, make sure you take your folic acid and make I not push you too much. You can go when you are 8 weeks. But women, most time, they like to wait when they are 3 months. That is 12 weeks, which is not good. Hmm? So make plans to go for your antenatal care and see your doctor. Is that okay? Let's see. We have a question here. So I'm live on Facebook, I'm live on YouTube, and I'm live on TikTok. I'm not live on Instagram. Should I go live on Instagram? Okay, let me do that. Let me go live on Instagram. Okay. I don't know when I will have this opportunity again. Instagram people, they can form. Okay. Sir, please, I do have some itches in the brain. I do experience it as in where someone eat food that mistakenly enter the brain. Please, I need solution, sir. Chiamaka, you have itches in your brain. Now, this is your question. This is your question. They turn my eye. What do you mean by itching in the brain? You cannot have itching in the brain, oh. But if you know you are having itches and your head they itch you like that, we go need to find out within the really happen. No solution social media. Beg. Thank you for the rose. Nobody don't send me star again for this live stream. Wow. Una no dey send me star, abi? They just dey look me. People want to enter my inbox. Sorry. So Chiamaka, I can't tell you what is causing your problem. I don't even have any idea. I don't even have any idea. I don't have any idea. Sorry, but you should be at the hospital. Make them really check you. Weeper, how can I know my fertile period? Go to Google Play Store, download Flow app. Download the Flow app. The Flow app would help you to make it easy for you. Just go to Google Play Store or the iOS Play Store. Download what we call the Flow app. The Flow app would help you very well. Download. It's called FLO. Helen, it's called FLO. How can I know my fertile period? You have 28 days cycle. Okay, 28 days. Then your fertile period would be your ovulation is on the 14th day of your menstrual cycle. So your fertile period, your fertile window would be from about 9, 10, 9, 10, 11, 12, 13, 14. That's your fertile window. 9, 10, 11, 12, 13, 14. Okay. I do experience it, especially when I overthink. Okay, Chiamaka, stop overthinking. Thinking will not solve the problem. Don't overthink. Don't stress yourself too much. Live your life. This network don't they misbehave. So let me use this one. Stop overthinking. Overthinking no fit solve problem. You get. Uh-huh. Overthinking no dey solve the problem. Rather, it go give you more issues. So I go advise you say if you dey overthink, eh, no dey overthink. Relax. Brokers don dey misbehave. Yeah, PJ Health, how you dey? Okay. Any more question for me? I dey live on TikTok, live on Instagram, live on Facebook, live on YouTube. Wow, only me one live this night on all this platform. Yet nobody don send me this thing. Eh? Ah, ah. Okay. I think it's time we end the live stream. I don't try. Okay. No more questions. Thank you, ladies and gentlemen. Thank you for your time. I appreciate every one of you for joining the live stream. You guys are awesome. You guys are wonderful. I appreciate you. Those that shared the live stream, thank you very much. Those that did not share, we just they look me, thank you. That did not even comment, thank you. Those where they monitor you, whether you go talk nonsense, where they drag you. All the monitoring spirits in the house, thank you. Oh my god, I don't tire. Okay, oh, I don't go, guys. Ladies and gentlemen, thank you for your time. Amarachi. Secondly, doctor, my body responds to food fast, especially morning tea and afternoon food from 11. From 11, once it's past that time, I start having headache, which is not like that before it starts this year. And I won't start to watch my weight, but I can help myself. But I can't help myself and have headache. And do you have headache? You close your eyes with serious pains. So Amarachi, this problem started this year, Abby. I will encourage you, say this problem wey you get, so you need more information though. Secondly, your body dey burn very fast, and then from 11 you start having headache. So let me just advise you. First of all, hope you are resting well. Hope you are resting well. Check your blood pressure. Check your blood pressure. Get your eyes checked. Go and check your eyes. Check your blood pressure. Those two, first of all. Then, if it still continues, you have to speak with the doctor. Hmm? I don't try. I have to go. Nice. Thank you, everybody. Thank you. I try. Yeah. Take care of yourself, ladies and gentlemen, and have a wonderful night. Remember, like I always say, yeah, my screen don't hook. Oh, away. God, I beg. Oh, wetin be this? Hey, God. Oh. Okay, it's back. Yes, like I always say, good life now waiting. Good life. Hmm? Good life. Nonsense. So I'll see you tomorrow by the grace of God. If I can come online, I'll be here online. But if I can't, it go be till Sunday. Till Sunday. Thank you. You can join my Facebook group. Make una join my Facebook group. I have a Facebook group. So just go to Facebook and type Doctor Fredostar Official. You can follow me on YouTube. Follow me on YouTube. You can join my community on YouTube. You join my community on YouTube. There's a subscription fee to pay. You can join and join the community. I can have a private call with you. I can have a private chat with you on Facebook. Yes, For those on my Facebook, my YouTube community, those that join, we can have a one-on-one call online. Yeah, those people are permitted to enter my inbox. Yeah, that's true. So take care of yourself and have a wonderful God. This thing don't again. This thing don't hook again. This thing don't hook again. God, no, wow. I don't suffer, and I won't end the live stream. What we say, guys, baby girl, sexy. Away, hey, hey, village people, don't do me shaggy. Make una see me see wahala o. My life should not be end. The laptop don't hook. Osalobo, browser don't hook. Okay, I beg make I go, make I end up. Thank you, Jesus. Wahala, can you see? This thing won't disgrace him, Papa, no be me. Oh yeah, oh, now take care.